The one thing that seems to have come out from some interesting discussions recently with people locally to me around this concept of the neurocafe, and they call it the cafe neuro, but the most fundamental, not fundamental, the most significant point in a person's journey with a neurological condition or any condition in that sense is the point at which their life changes in a split second from being somebody without a diagnosis to suddenly, when the news is given, their life is totally and utterly transformed in the seconds in which they hear that news. And that's the most, that seems to be the most significant element of change that there is, because from that point on, the change has happened or is happening, and then the consequences of that change start to take time to come to terms with, I suppose, is a phrase, whether that's the right phrase. But there are elements, obviously, at that point where, at that point, also, you won't necessarily hear everything that's been said to you either. Um, so it's exploring that aspect as well, I think, in terms of if you're giving that news, if you're giving that life-altering news to somebody, perhaps the awareness of that person giving that news might help them then to appreciate the aspect of almost, I was going to use the word slowing down in describing the diagnosis, or slowing down in terms of the recognizing that what's going to happen to the person in terms of the change or the shutting down of their senses to the news, and being aware of how you best manage that as a practitioner as well. But then the element of how you are as a practitioner, knowing what you're having to do and what you're having to say to the person, and the impact it also will have on you and your emotions.
I think the way that sort of life altering news is broken is really really important. You know, when I've been thinking about this, it's now sort of it's 6.5 years since I walked in and then walked out of the neurologist's office that day, and I think for me it was like you said, there was a lot of stuff that I don't totally remember. He didn't go into it in a lot of detail, and I think that was a good thing, because he gave me some key points to really take away. And I don't know whether he talked to me like a as a medic or as a patient, or as a bit of both really. So I'm not sure with how he broke that life altering news in my situation was necessarily the same as what he would have done with a patient who wasn't in a medical background. But he was very clear that, you know, that this was idiopathic Parkinson's disease. He said it he said it in such a way that there was no wriggle room. In fact, he actually I think he tried to tell me first of all by saying that I needed a DAT scan. So to tell this story, my wife was sitting beside me, and he said, after he taken the history and examined me, he said, "Jonny, you need a DAT scan." So I think that might have been his way of telling me that I had idiopathic Parkinson's without saying the words idiopathic Parkinson's. So I always say, you know, I went to every lecture at medical school, might have missed a few. Certainly my neurology block and my care of the elderly block. I didn't I didn't I didn't hear anybody mention the words DAT scan, so I didn't I didn't know what he was talking about. So my wife, who was sitting beside me, she was an ST4 in psychiatry training, and she turned around to the neurologist and said, "He doesn't know what that is." but she did, because she used to order DAT scans in her clinics to decide if somebody had Lewy body dementia or another cause. So he then said, Jonny, you've got idiopathic Parkinson's. So I think, you know, even when you still talk about it now, it just brings you back to that seat. You can still remember the room, you can remember the way it was set up, you can remember the time, you remember walking out of the door in a bit of a daze in the car park, you know. But he did say, you know, certain statements that I still remember. So he said, you've got a degenerative neurological condition that will get worse over time. He said that there's no cure presently. He said there's lots of good research going on. He said there's good medications that will treat your symptoms. They are mild at the moment, but they just mask the symptoms. And he said exercise is key. And that's pretty much the way that he put it. And at that stage, you know, there is I mean, everybody goes through adjustment. It's like suddenly, I mean, the main thought I had was, you know, walked into that office that day with my life on one path, and then I walked out, and it was nearly like it was on another path, and I didn't know what that path was. I didn't know how long the path was. I didn't know how many twists and turns in the path was. I just knew I was on a different path, and I wasn't going to be getting back to the path that I was on. And I think that's the biggest adjustment. It's the unknown. It's the unknown. So that is the biggest thing that patients have to deal with. It's just the unknown. And I think, you know, 6.5 years down the line, you know, if he was able to tell me what I would be like now compared to what I was like 6.5 years ago, I think maybe a lot of that fear and anxiety and the unknown wouldn't have been there. But then everybody's different. You know, they've no way of knowing what your progression is going to be like. So it is, and I think that's where the fear comes in. It's the fear of losing stuff, of, you know, can I still work? Can I still exercise? Will I be able to walk my daughter down the aisle when she's, you know, whatever, 25, 30, you know, she's 12 now. So, I mean, that still comes into my mind, but it was more so when I was first diagnosed. It's just the unknown, really. And I think, you know, healthcare professionals, when they give life-altering news, you know, I think being realistic, but giving patients a degree of hope and being honest.
I'd agree a lot with what Jonny said. He said my experience, I think, was very, very different, because I'd had some sort of relapse, and I was a psychologist working with multiple sclerosis, so I knew all about multiple sclerosis, and I'd had some symptomology that seemed very akin to that, but it kept ignoring it, thinking I'm picking up symptoms, I'm sort of reading things I can't see. So when I finally ended up becoming quite poorly, really, and obviously I went to see a neurologist and sat down with a neurologist, and he first and foremost said, I think we need to get you into hospital. So that was almost like that. And then when he came to see me, he said to me, well, we've done your scans, which I obviously had been and had my MRI scan, and he just said, well, at the moment you've got a lesion. I'm going to call that clinically isolated syndrome. Obviously, you know what that is, because, you know, you work with patients like this all the time. You know the prognosis of that, or the possibility of it. If you've got any questions, we'll talk about it next time I see you in clinic. And that was it, and off he walked. And I was sitting there having my cortisone and things like that. And of course, I did know what it meant. But I think for me at the time, it was just like, well, okay, so what does that actually mean? You know, I know that, you know, it's good to have treatment. I know all these things, but I'm now a patient. I'm no longer a professional. I'm a patient. And you hear the terms, you know, well, bed number 5 is suffering from, or bed number 5 is the CIS or the MS or the Parkinson's. And, you know, you hear other professionals talking like that when they're doing their handovers. I was just by the nurse's station, but I've sat in those handovers. I know how it's discussed. And I think for me, it was, I suddenly, like, I think Jonny's explained, I suddenly felt, well, what happens next? What is going to happen next? This is really scary. It's the unknown. I've seen and I work with patients, so I know all the possibilities and all the individualized outcomes, but what's my outcome? What am I going to get from this? And I think there's an element of, since obviously all that's happened to me, and I've carried on working, I've had patients say they almost feel like they become a victim of something because they aren't given hope, and people want to be open and honest and realistic, but in doing that, they don't actually say, well, you know, I'm going to be completely honest with you. I actually don't know where you're going to end up because I can't. Well, I can tell you if you've got progressive condition. However, we're going to, if we work on this together, if we journey together, we can just face things together. And, you know, you'll have your appointments. You can always contact us. You'll have the facilities around you. But I don't think, in my experience, that's what happened. It was like, well, you know what to do. Go ahead and sort it out because I'm a professional. And it was very, very different for me because I've had cancer diagnoses since. And I have to say the best diagnosis I had was when I went in to see the consultant who sat me down and said, right, the GP's spoken to you already. I know that. So you know probably what I'm going to say to you, but let me explain it all to you. And he spent time and he gave me options and he allowed me to choose the options, although telling me there was only really one option. But he spent time and he explained things, and it was an area I didn't know anything about. So it was really important. And I think for me, I felt like he was there with me. He was in that moment with me, talking to me and sharing it with me in a way that felt really empathetic. You know, I wasn't dismissed. And the time frame of both diagnoses, if I compare that positive experience to the more negative one, was probably roughly the same amount of time. It was just I left there thinking, okay, I have another road to face, another journey to do, but I know that somebody has given me hope that whatever comes out of it, we will fight this together. And that was really what I felt.